Spurs center Victor Wembanyama is expected to miss the remainder of the season due to a deep vein thrombosis in his right shoulder. Let's break this down. Let's orient ourselves to the right clavicle and the first rib. Between this costoclavicular space, you'll find two types of blood vessels. In red is the arteries, where oxygen-rich blood from the heart is pumped out to provide nutrients to the body. And in blue, we have the veins, which bring deoxygenated blood back to the right side of the heart. This is the subclavian and axillary veins here. A deep vein thrombosis is when a blood clot forms inside one of these veins and is firmly attached to the inner lining of that vein. The most common reason for a right-handed NBA player to have a deep vein thrombosis, or DVT, in this region is sometimes due to effort-related thrombosis, aka Paget-Schroeder syndrome. This is when repetitive overhead motions like shooting, blocking shots, and even passing compresses these veins over and over, subsequently leading to blood clot formation. Effort thrombosis occurs when the subclavian vein is compressed between the first rib and surrounding muscle. In addition to creating clot formation, you see decreased venous return to the heart here. The concern with these blood clots is that they sometimes dislodge from the site where they form and become an embolus. These emboli can travel to the right side of the heart and become lodged inside the lung, where they can block off a branch of the pulmonary artery, subsequently obstructing blood flow to different parts of the lung. This can lead to low oxygen levels, right heart strain, potential lung damage, and large clots can even become life-threatening. These clots are treated with at least 3 months of anticoagulation, aka blood thinners, that can help dissolve the clot. And during this time, doctors do not allow athletes to participate in contact sports because even mild trauma can lead to life-threatening internal bleeding. Rarely, they also might require surgery through a catheter or even a thrombectomy, where the surgeon has to go in and cut out the blood clot. Sometimes these require surgical removal of the first rib or the scalene muscles to free up compression. The concerning thing here is that you also have to rule out genetic or blood clotting disorders. You might recall Chris Bosh's career prematurely came to an end due to him having recurrent blood clots, and he also had the complication of a pulmonary embolism. Let's hope this isn't the case for Wemby, because he's been one of the funnest players to watch in the NBA this year. Wishing him a safe and speedy recovery.